Hi, I'm Dr. Tananya Haile-Mariam. I'm an emergency physician at George Washington University Hospital and a faculty member at the George Washington University Medical School, where I work as an emergency physician in the ER here in downtown Washington, D.C.
Hi, I'm Dr. Neil Sikka, and I'm also an emergency physician and faculty at the George Washington University. So we've been talking quite a bit recently about how we can learn from what we've been doing in healthcare to help businesses reopen in the area. And one of the things I've been reading about was about this hairdresser in Missouri who came to work sick and spread infection to over 140 people. Do you have thoughts on how we can help prevent these types of events?
Neil, I have a couple of thoughts. The first is the news is full of reports of events that are difficult to explain and therefore make it more difficult for us to go about our lives as we start this reopening. Whenever we hear that one person has made many, many people sick, it makes all of us scared and worried as to whether or not the facts are really straight and if anybody really, really knows what's going on with COVID. The good news is we do have experience with this disease, and it is added on to the long history of experience that we have with epidemics and other viruses. To be certain, there will always be times when there is something very reportable, such as this event. This event would fit into a category that we might consider a, quote, super spreader event. And even from the word, you can see, once it's called a super spreader event, that it signifies that it's probably a relatively rare event. I think the lesson that all of us need to take from this is that if anybody is sick, they should be very responsible and stay away from other people whom they might infect and make sick. This is especially important if that person is working in a forward-facing role where they come into contact with many people in the public, because if you spread it to one person, they can spread it to many more people. And if you come into contact with 140 people, you certainly can be more in trouble in terms of a community getting infected than if you only ever came into contact with one person. As business owners, it's very important that people who work for us understand that it's absolutely okay with us if you do not come to work if you're feeling sick. We prefer you not come to work if you're feeling sick. In order to have this system established with your employees, it is very important that a good relationship be established amongst everybody in a business environment. I hope that's helped to answer some of your questions, Dr. Sikka.
I think that makes a lot of sense. I mean, as emergency physicians, we've had a long history of working through it, right? Never calling in sick and feeling like, the rules don't necessarily apply. And I think through COVID, we've really changed our mindset. We can see that in the culture of the department. I think our lines of communication have significantly improved, especially when we present with any types of symptoms. So hopefully we can carry that through and help other people change their culture as well.
Absolutely. We're all in this together. We need to take care of each other. And part of taking care of each other is making sure that you don't come to work when you're sick, because you might have exactly the opposite effect of what you wanted to have happen, which is you wanted to help your colleagues and help the people that come to your place of work so that you can serve them. Instead of doing that, you might just be serving them up a little bit of COVID, and nobody wants to do that, do they?
No way. All right.
Dr. Sikka, I wonder if you've come across this situation and wondered what you might advise a person. I've seen people who have come to the emergency department eager to get back to work, and their work is such that it takes them into other people's homes. For example, people who are appliance repair people, or people who work cleaning people's homes, or even surveying people's homes, doing estimations and such. But their workplace is in other people's homes. I've wondered what sort of advice would we give employees and their employers who have businesses that require people to go into other people's homes in order to make their livings.
So I think, we're all in this together. And so this is a two-sided coin. We need to, as a business, advise those who are purchasing our services, the homes that our employees are going into, have to take the necessary precautions to protect our employees. And they should be aware of those things. So we need to have a straightforward dialogue with our customers. And that would be, making sure that if our employees are coming into the home, that those homeowners would be wearing a mask, that they would keep a distance, that they would keep the entryways uncluttered so that, say, a delivery could be made into the home without forcing our employees to have to navigate a complicated component of the home or come into contact with areas that they don't necessarily need to come in contact with. So really it's a minimization of exposure type of proposition that we need to make sure our customers understand. Now, we can also do preventative types of activities by putting solid policies and procedures in place. So first, we should think about making sure that our employees feel very comfortable reporting any symptoms that they may have before they come to work. And that way we can keep them away from the workplace and exposing our customers as well as their colleagues. I also think we have to make sure that we provide them the appropriate PPE. So they should be wearing masks. They may need gloves in some scenarios, and they'll need cleaning equipment. So whether that's disinfecting wipes or sprays or other approved product that they can use in the appropriate scenarios. From there, we need to make sure we have adequate monitoring. So if our employees are going to be exposed potentially in a regular basis, then we could give them tools to be able to tell us about those symptoms or about situations they think might be more risky to them so that we can be even more vigilant after those scenarios. And then we may need to offer testing. And those types of testing policies and procedures may be very unique to each business and would be the types of discussions that we would have in great detail to determine what is most appropriate.
Certainly, you've given us a lot to think about. I was thinking the big thing people used to be afraid of when they went to somebody's house was maybe there's a dog there that would be unfriendly. But certainly now there's many, many more potential pitfalls that could affect our customer base as well as our employee workforce. Therefore, I think the point you made about having very good, comprehensive policies and procedures in place and having that sense of we're all in this together, and that includes our customers, our employees, and the people who are running a business have to all be on the same page. Otherwise, it'll be very difficult to gain the trust of both the customers and the employees who are putting themselves in what could be a situation of great jeopardy. Thank you. That was a really good answer, Dr. Sikka.
Thank you. Okay. So, Dr. Haile-Mariam, we were walking the building the other day, and we work in a very unique space where we have incredible teammates and individual offices, common hallways, and then we have classrooms, and then conference rooms, a break room, and a couple of other very unique work areas. So it seemed to me that there were a number of unique challenges to maintaining hygiene in this space. Do you have some thoughts on how we might tackle some of those challenges?
I think the first thought is that every workplace is unique and the challenges will be different. And there will be no one size fits all. There will be some solutions because they're based on good science that have applicability over different situations. But all of this has to be thought through very carefully. It depends on how many people are in a place at the same time, how many people have to handle a machine, under what sequence. Do people work mostly at their desks or mostly in a communal area? Do they work mostly at the same time or do they have staggered times? All of these things have to be taken into account when one comes up with a comprehensive plan for protecting all employees, all visitors, and people that might be coming to your place of business as customers. So I'm sorry to say, there is no one size fits all. Every situation, just like ours, is going to be unique. And that's why it's important to turn to people who have some sense of what the good science is in developing a plan with you.
Great, thank you. All right. Hi, Dr. Haile-Mariam. I just came off shift, and I had a number of patients who had decided they needed to get a COVID test before returning to work. And we've heard that DC is going to open up really soon. Can you tell me a little bit about the value of testing?
Any medical test is only as good as the reason you're using it for. Tests are designed to answer a question. If your question is, can I give somebody COVID, and you come in for a COVID test, the truth of the matter is, even if the test is negative, it doesn't mean that you cannot give them COVID, because it might not be a test that is a true positive. You have to have a comprehensive evaluation in order to have a comprehensive answer. So testing is just one part of a comprehensive evaluation to see whether somebody should or should not be in a public-facing employment situation. Hi, Dr. Sikka. I just got off a shift, and there were so many questions about testing. I think the one I heard the most was people who are eager to be getting back to work and wanted to be able to show their employee that they had gotten testing, that it was negative, and therefore they were safe to go back to work. And I found myself thinking, I don't think that's the whole answer. What do you think, Dr. Sikka?
Yeah, I think you're right. I think both employers and workers struggle with this. They're naturally worried about going to work and contaminating or infecting someone else. But I think it's important to realize that testing has its limits. It may give a false sense of confidence because the test is really a single point in time, and it has particular characteristics that that based on how it's collected, when it's collected in the course of disease, may change its test characteristics like true positives or false negatives. So we want to avoid that over sense of confidence, and testing should be a part of a much larger comprehensive policy of reopening, monitoring, contact tracing, and testing.
Thank you.